Hello and welcome to the second module of Nature's Farm training session. Today we will be learning about bone and joint health and how to protect them with the right nutrition. As we age, our body reabsorbs calcium and phosphate from our bones instead of keeping them in our bones, which makes our bones weaker. When this process reaches a certain stage, it is called osteoporosis. This results in low bone mass and a deterioration of bone tissue. Osteoporosis leads to increased bone fragility and risk of bone fracture, especially in the hip, spine, wrist, and shoulder. Women over 50 and men over 70 have a higher risk of osteoporosis than younger people due to a drop in the hormone estrogen level among females and the hormone testosterone level among males. Many factors play a part in bone deterioration. For example, aging, unhealthy eating, and an unhealthy lifestyle like smoking and drinking. A diet low in calcium, magnesium, vitamin D with an excessive intake of processed food can weaken our bone matrix because sugar is acidic. When the body acidity level is high, our body withdraws calcium from the bone matrix into the blood to reduce the acidity level. This is how sugary food and beverages can weaken our bone structure. On top of that, heavy medications like corticosteroids can cause osteoporosis when used chronically. A sedentary or stressful lifestyle can also weaken the bone matrix too, which can affect the body's metabolic functions as well. Healthy bones are important as they help to support key functional roles in our body. First of all, they protect the most important organs in the body. Our bones pair up with the joints, ligaments, tendons, and muscles to enable the body to move. The bone marrow, found in the central cavity of the body's longer bones, are crucial for producing both red and white blood cells. Also, bones are responsible for storing important minerals like calcium and phosphorus. The higher the deposition of minerals in the bone, the stronger the bone will be. Fatty acids are stored in the yellow bone marrow and serves as energy reserves if needed. Our bones are also in charge of controlling fat deposition and blood sugar level by releasing the osteocalcin hormone, which is known to increase insulin production to reduce excessive fat storage. Did you know that we are born with over 300 bones? However, as we grow, some of our bones grow together and we are left with 206. According to scientific studies, most new bones are added during our childhood and teenage years. As a result, our bones are denser, heavier, and stronger in our early 20s. Bone formation will continue when the maximum solidness and strength is reached. Our peak bone mass and density is reached around the age of 30. After that, bone resorption gradually exceeds the new bone formation, leading to bone loss. Bone loss in women is especially fast in the first few years after menopause due to a sudden drop in the estrogen level. As we grow older, our joints are also prone to deteriorate, loosen, and get inflamed. The factors that contribute to poor joint health is due to overexertion of the joint, the aging process, and a sedentary lifestyle. Joint health problems like osteoarthritis and the rheumatoid arthritis are the most common problems today. In a healthy knee joint, we will have healthy bones, healthy cartilage, and a healthy synovial cavity. When stuck with osteoarthritis, bone spurring and cartilage erosion will occur. It involves the thinning or destruction of the smooth cartilage that covers the ends of bones and changes the bone underlying the joint cartilage. It produces pain, stiffness, and reduced movement of the affected joint, which can reduce one's quality of life. On the other hand, rheumatoid arthritis is an autoimmune disease where the body's immune system attacks normal joint tissues, causing inflammation of the joint lining. The inflammation of the joint lining, called synovium, causes pain, stiffness, swelling, warmth, and redness. The affected joint may also lose shape, resulting in loss of normal movement. Prevention is always better than cure. On top of a healthy lifestyle and good eating habits, integrating Nature's Farm health supplements into one's diet can help improve bone and joint health. A Nature's Farm bone defense formula is formulated to strengthen our bone structures. It is made up with the optimum ratio of 2:1 of calcium and magnesium, plus vitamin D. It is formulated with a highly absorbable form of calcium called calcium citrate. It is then further enriched with ginger, cayenne, turmeric, rosemary, bioperine, and ipriflavin to ensure optimal absorption and utilization from the body. Ipriflavin is a phytochemical ingredient that retains bone matrix and stimulates bone formation. It is also enhanced with betaine to facilitate calcium absorption. The recommended dosage is 2 capsules after meals, 1 to 2 times daily. This bone defense formula helps to promote healthy bones and teeth, maintain a healthy nerve function, and support muscle contraction. Another supplement called the Nature's Farm Joint Pro can also help to improve joint health. It is the classic joint supplement formula that contains glucosamine and chondroitin, which is important for cartilage formation. Methylsulfonylmethane, also known as MSM, contains natural organic sulfur compounds which can help to improve joint health. Every serving of 3 tablets provides a clinical dosage of 1,500 milligrams of glucosamine, 1,200 milligrams of chondroitin, and 1,125 milligrams of MSM. A daily recommended dosage is 3 tablets after a meal. This product can help to rebuild the joint cartilage, cushion, and lubricate joints. A Nature's Farm Joint Plus with Celadrin is another supplement for joint health. It is a synergistic formulation with celadrin, glucosamine, and MSM. It is a fast-acting natural pain and inflammation relief solution. Each tablet provides 250 milligrams of glucosamine, 250 milligrams of celadrin, and 50 milligrams of MSM. What is celadrin? Celadrin is an all-natural proprietary ingredient for joint mobility and health. It comprises of esterified fatty acid carbons and other active synergists. The esterifying process makes the fatty acid more stable so it doesn't react with oxygen. This is an award-winning patented ingredient, and studies have shown that celadrin can significantly improve knee function and relieve discomfort. Celadrin can improve the functioning of the cell membrane by protecting the cell and repelling the stresses. It can inhibit inflammation in the endothelial cells, which are the thin cells that line the inside of some body cavities. It works directly on white blood cells by reducing the production of immune factors, which are responsible for inflammation, and plays a role in the lubrication of affected joints. The synergistic dual action of celadrin and glucosamine can help to cushion our joints better. It can also relieve joint pain, stiffness, and inflammation, maintain a healthy joint structure, and support functions of the joint. This product is a natural and clinically proven solution without side effects. The daily recommended dosage is 3 tablets 2 times daily after meals. However, this product is not suitable for people who are allergic to seafood. Apart from these products, there is a range of supplements from Nature's Farm that can strengthen bone and joint health. They are the following: Nature's Farm Calcium Citramate, Nature's Farm Omega-3 1000, and Nature's Farm Multiflex. We hope you enjoyed this session. Thank you and goodbye.